And good morning, everyone. My name is Randy Lober, your growth marketing manager here at Action Benefits, and happy to have you along for today's session where we'll be talking about Medicaid, Medicare, D-SNPs, and what all happens behind the scenes as it relates to you as agents and the help you might support you might provide to your clients throughout. Joining me today is one of our account managers from the individual team, Kevin. He might even be your account manager. Kevin, want to give you a chance to say hi before we get started.
Hey everyone, I'm happy that you're all here with us today, and I hope you find this webinar very helpful.
Thank you for joining us here today, Kevin. I'm sure our agents will appreciate all the knowledge and expertise you bring here today. And hopefully we'll all leave here a bit smarter than when we walked in today's session. So let's talk about, without any further ado, what we want to accomplish here today. First, we want to start with the real nuts and bolts stuff, and we're going to define Medicare and Medicaid programs and how they interact with each other here today. A key part of the process here is understanding Medicare savings programs and how they interact and how you qualify for them and what that means for D-SNP eligibility going forward. And then in the last third or so of the presentation, we'll talk about how Medicaid and Medicare actually work together to pay for healthcare for dual eligibles. So as I said, we want to start first by loosely defining our terms and knowing that what exactly it is we're talking about here today. Likely, if you are a Medicare agent, you know that Medicare is built as health insurance for those that are 65, those with disabilities for 24 plus months, or those with ESRD or ALS, which you can qualify for immediately upon diagnosis for the program. Medicaid is health insurance for those with low incomes, and you're probably nodding along and going, "Yeah, Randy, get to the good stuff. Tell me something I don't know, or give me an aha moment here today." And where I'm hoping that comes is in the last two bullets you see on your screen here: Medicare savings programs and extra help. Here is by far when our individual teams talk to the agents, or even when I'm talking with agents, where we hear some misconceptions about these two ways you can get help paying for your Medicare costs. First one is that Medicare savings program, which in itself is not Medicaid. So whenever you hear someone say MSP, it doesn't necessarily mean they're on Medicaid. But these benefits tend to be administered by state Medicaid agencies, as they are here in Michigan. The key difference between Medicaid for those who are not Medicare qualified and a Medicare savings program is that there is an asset test that accompanies Medicaid, the MSP eligibility. So whereas Medicaid is typically based on monthly income for eligibility, MSPs look at monthly income and monthly assets that are available to the beneficiary to draw on. The other thing that comes into play here is Part D extra help, or low income subsidy, or LIS, 3 different terms for the same program. That's also not a Medicaid program. It's run exclusively by Medicare and does help to pay for some Part D costs. Kevin, I know as we were talking in our preparation for today, you thought there was a few things you want to call out about some differences here too.
Yeah, I would just say, just make sure that you check your members' eligibility before applying. The good thing is our carrier partners have excellent tools to check Medicare and Medicaid eligibility. And if you need any assistance, we have a team full of people who are ready to help you.
Yeah, absolutely right. Anyone on an individual team can, and even through Sunflare or other tools that are available to you, we can certainly help you get that done. All that said, I also want to talk about, just as kind of table stakes here, setting out what the general order of operations is for becoming D-SNP eligible, so we know exactly who it is that we're talking about here. So of course, someone's got to be eligible for Medicare, for whatever reason they are eligible. Maybe it is disability, maybe it is one of those targeted disabilities, ALS or ESRD, or maybe it's because they've aged into Medicare. Any of those 3 flavors of eligibility works here for today's discussion. Once they've done that, if they're going to enroll in a D-SNP, they, just like any other Medicare Advantage plan, they'll need to have enrolled in Part A and B. And here is where we had a wrinkle into the mix in step 3 here. They may need to apply for a Medicare savings program through their local state Medicaid agency. In Michigan, that is the Department of Health and Human Services. Generally speaking, that application and entry into an MSP or Medicare savings program is an automatic process, but it isn't always. So it's always helpful to have folks, your beneficiaries, double check that they have applied or double check that they've received letters or paperwork saying that. And you can always check for eligibility using carrier systems, or we can help you with that, or even Coverage for One, powered by Sunfire, can help you with that as well. The second ingredient that we'll need to think about is LIS, or low income subsidy or extra help. And that program, again, is administered by Medicare through the Social Security offices. Generally speaking, it is an automatic process. So when someone qualifies for certain Medicare savings programs, they should also be automatically entered into the LIS program. But sometimes that doesn't happen. I don't want to say it's a very common occurrence, but I would say, we have better than 2 or 3 calls a week that come into the individual team that say, hey, I have a decent member who is receiving a bill for a premium for the Part D portion of their plan. What gives? And generally the root cause there is that the LIS application wasn't automatic. So always want to make sure you're working beneficiary to verify they are eligible and receiving LIS in that case. And if all of the above is true, if they've qualified for an MSP, and if able, they've qualified for an LIS, they should now be eligible for a DSNP. So that, again, is that general order of operations. Some things will happen in different orders here. I should also point out that you can apply for Medicare savings programs without being on Medicaid, because they're not exactly a Medicaid program, though they are administered by Medicaid agencies. So I want to check in here for a moment. Is it possible for someone to enroll in a Medicare savings program without being on Medicaid?
So the answer is absolutely yes. Depending on the person's income and assets, the Michigan Department of Health and Human Services may help pay for Medicare premiums, deductible, and coinsurance.
Yeah, absolutely right. So there are savings programs that are independent of Medicaid. Important to call out here, because again, there's a lot of people do hold that misconception that that they're one and the same, right? That Medicare savings programs and means automatic Medicaid and vice versa. It's not quite that cut and dry. So thanks, Kevin, for offering that. And thank you to all the confident yeses and even the question mark yeses here today. Let's talk a bit about those Medicare savings program, because they do help to shape eligibility for DSNPs going forward. So we will talk about the 4 Medicare savings programs plus the subdivisions of each, and add in one more category that can help us with DSNP eligibility as well. But first, we should mention that because there's income and asset tests associated with Medicare savings programs, we should figure out what income counts and what assets count. As agents, you likely are not in the business of counting this for your clients, but it's helpful to have a ballpark here, right, of what they might have in their possession. Ultimately, that determination is up to the state Medicaid agency and so on and so forth. But if you're working as an advocate, you're providing that support to your clients, it's helpful to at least be familiar with what the state might be looking at. So on the left side of the screen, anything that is a liquid asset, so whether that's cash, stocks, or bonds, or at least fairly liquid, could be liquid soon. If you think back to economics, you're thinking about your M2 here, right? Anything there could, counts in the income test, that fund test. Things that don't count toward their assets, though, are the ownership of a home, the ownership of a car, one burial plot, up to $1,500 extra in burial expenses, the furniture and what they need to make that home livable, and any household or personal items. So all of those things are excluded from the asset test, but generally everything you see on the left side of your screen is included in those income and assets. We should point out though that if they are a multi-car household, right? Or there are multiple cars there, those would be included in the asset test here and could sway their eligibility for a Medicare savings program. So briefly, as we talk about Medicare savings programs, I want to give you this snapshot. If there is nothing else you take away from here today, I encourage you to take a screenshot of this screen, just because it really encapsulates what I'm about to go over in some more detail on the next few slides. So there's a variety in the left-hand column. There's a variety of Medicare savings program categories and ways that beneficiaries may qualify for them. In the second column, you see whether the beneficiary is entitled to Part A premium assistance under that program. So for example, if you were a Quimby or a Quimby Plus, for example, you are entitled to assistance with Part A. Same if you're a QDWI or a partial dual, you have some options to help you pay for Part A premiums as well. The second column, you see an indication of whether or not that program covers Part B premium assistance, whether in all or in part. In the third column, one thing we should call out here is whether the beneficiary has any cost sharing protections from Medicare in this case going forward. So your FBDEs in Michigan, at least, are fully cost share protected, cannot be balance billed for anything. Any Medicare approved costs. Same with Quimbys and Quimby Pluses, and we'll detail those in just a moment. Your Slim B Pluses have that same cost share protection as well, but note that if you happen to work in multiple states, their protections may vary. In the last column, you see a quick note on whether or not this category is considered to receive full Medicaid benefits. The only three categories here that do receive full Medicaid benefits and therefore have access to all the supports that Medicaid can offer, there are your FBDEs, so your full benefit dual eligibles, your Quimby Pluses, and your Swimby Pluses, who are also fully dual eligible. You may have questions, and that's okay, because on the next few slides, I hope to give you some answers. So when we say Quimby or when you say QMB, detailed on a plan guide or anything of the sort, what that really means is qualified Medicare beneficiary. And those who are eligible for this program are entitled to help paying for their Part A premium if they're subject to one, their Part B premiums, deductibles, co-insurance, and co-payments. Really helps to take care of a lot of their health expenses. Should note that this program only covers months going forward. So it does not look back at all in the calendar year to help pay for any costs already incurred. It only looks forward from the date that eligibility is verified. On the right side of your screen, you see income and resource limits here for this year in 2024. Do note that those figures update yearly. We should also note that because this program does provide the most support to beneficiaries, this one does have the strictest or the lowest income and resource limits. There's a flavor of Quimby out there, though, called Quimby Plus. The plus in this case tells us that the beneficiary meets all Quimby eligibility criteria, but also is eligible for full Medicaid coverage. And they can qualify for that coverage in two ways. One is they're qualified for Medicaid by meeting that medically needed standard, or they maybe have the option of using a spend down to get down to that medically needy standard. In simplest terms, if you are close to the Medicaid limits, you're close to that threshold for being medically needy. In some cases, the state will allow you to use what's called a spend down. That spend down is an amount you have to spend on medical expenses, including doctor visits, hospital visits, drugs, any necessary medical care, before the Medicaid benefits go into effect. And in Michigan, that spend down resets every month. So you can think about it in some ways like a medical deductible that happens before Medicaid comes into effect. We've heard tales, of some beneficiaries who are Quimby Pluses, but they have a $500 medical spend down before their Medicaid benefits kick in. So they have to maybe go to the doctor a few times. Once they have those $500 of qualified medical expenses, their Medicaid benefits then kick in for the rest of the month, meaning that Medicaid will cover things in full or in part or with copays as Medicaid, their Medicaid benefits are designed, but the first $500 of medical care are entirely their responsibility. And that spend down note is important because it does impact or can impact extra help and some other things going forward. Let me know whether that kind of explanation as a monthly deductible does it for you, or you need more than that. Good question, Susan. So with that spend down, Medicaid or CMS does not get involved. That is the state Medicaid agency who will track that spending. In this case, it's DHHS, or you might have the local carrier who administers the Medicaid benefits who is tracking that spend down. All right, let's talk about what other protections QIMBY qualifiers also get. First thing you should know is that Medicare providers can't balance bill the beneficiary for any service Medicare covers. So if there's anything unpaid by Medicare or by the MAPD or DSNP in this case, the provider is going to eat that cost. Medicaid may collect a copayment in this case if applicable. Generally, they're in the $1, $3, $5 range or so, and they should, generally speaking, be automatically enrolled in extra help for Part D, in which case here in 2024, they're paying no more than $11.20 per drug fill. However, as I mentioned at the top, that process isn't always automatic. Second category I want you to know about are SLIMBs, or your specified low-income Medicare beneficiaries. This program only helps pay for Part B premiums if the person is enrolled in Parts A and B, and it will cover up to 3 previous months of Part B premiums and all future months where the income is above the QIMBY limit but below the SLIMBY limit. So on the right-hand side here, you see a slightly higher income and resource limits associated with the program. So think of this as slimmed down supports, right? So if the QIMBY is the most robust supports for the beneficiary, SLIMB is slimmed down. And there is a SLIMB plus variation where, again, that spend down comes into play. So they could meet the criteria here for being eligible for the SLIMB program, but that plus tells me they're eligible for full Medicaid as well. And they're either eligible for Medicaid because they're at that threshold, or they have a spend down, in Michigan at least, that's monthly to get them down to that threshold. I should also note that for QIMBYs and SLIMBs, they should automatically be enrolled in extra help. But again, that process isn't always automatic as it should be. So want to check that out with them as well. A lot of words, a lot of technical vocabulary coming to you. But really what's important, I think, for you to know here is the answer to this question. And if you know this, we're doing well here this morning. What does the plus designation mean? So if I were to compare SLIMB versus SLIMB plus, what does the plus do for a beneficiary? What does that tell us about their status?
Yes, the plus designation means that the member meets the financial criteria for full Medicaid coverage.
Absolutely. Full dual eligibles in that case. If they are just a QIMBY or a SLIMB, they're only partially dual eligible in that case. The plus is what gives them the full dual eligibility. So, and the plus is often what you'll look for in when sorting through and identifying DSNPs that could be a good fit for your person. Although there are DSNPs you can qualify for in these next 2 programs here as well, which is why I want to talk about them for a moment. First one is the Qualifying Individual Program, or just QI. This program also helps pay for Part B premiums if enrolled in Parts A and B. You'll see here that the limit is about the same as or a little higher rather than SLIMB was, and the resource limits are the same here for singles versus married. The big difference in QI, though, is that this does require a yearly renewal. and that is on a calendar year basis, goes along with their regular Medicaid redetermination. Now that that is back here, and that coverage for the QI, so that assistance with the Part B premium is only good for the current year. This program states approve funding for beneficiaries this on a first come, first served basis, with preference given to those who received the benefits last year. And states can fund this program at their discretion. So you may have someone who was eligible last year, but maybe is not eligible this year because the state hasn't funded this particular program. So that's something to think about here as well. QI beneficiaries do qualify for extra help, but again, not always automatic as it should be. And one key difference here, though, is if someone does qualify for Medicaid, they can't get help for this program. So this is this is help for someone who is lower income, but is not eligible for a spend down, is not eligible for Medicaid, but still needs help paying that $174 a month or so. There's also the QDWI program, which is Qualified Disabled and Working Individuals. So this is really built for individuals who are under 65, were disabled for a period of time, but have now returned to work and now are subject to paying a Part A premium. So if the beneficiary has a disability and has lost their SSDI and premium-free Part A because they returned to work, and is not eligible for Medicaid, they can get assistance with their Part A premium. You'll see here that because the Part A premium is generally more expensive, your income and resource limits here are a bit higher here as well that you'll want. So again, another way to provide support to a really vulnerable portion of the population. So real quickly, want to check in, make sure we have all these programs under our belt. How would you describe the differences between Quimby's and Slimby's and their plus variations in QI and QDWI? Right, the first set of programs there is eligible for Medicaid. The other ones are not. Kevin, I might have stole some of your thunder there. What else might you have to add?
Yeah, I was just going to say that Quimby and Simply are programs that are built for people who are Medicaid eligible. They will help pay for either your Part B premium or all of your premiums, deductible, and copays. And the QI, QD, programs are for people who are not Medicaid eligible, but still might need help paying for their premium.
Yep. So the application process for those, if not automatic, is to go to the local branch of DHHS or go to michigan.gov/MIBridges. That application or that brochure does walk you through the application process, what you can expect, what appeals would look like. And as part of the application process here, they would notify you or the beneficiary what program they qualified for. There's also, I should note up front that there's no penalty for applying, right? So if you have someone that might be on the edge and they don't know whether they should apply for an MSP, the worst that happens is they say no, right? Is that the state says, no, you're not eligible for that. So if you have someone that's kind of on the borderline, leave it up to the state there, right? In some cases, let them check the income, let them check assets and see if your beneficiary can get that much extra help, which they might need if they're close to the thresholds here. Speaking of extra help, capital E, capital H extra help, I should point out again that it's not a Medicaid program. Any Part D enrollee that has income up to 150% of FPL is eligible for extra help, and beneficiaries apply for that program through either ssa.gov or their local SSA branch. So again, if you have someone on the thresholds here, right, maybe they haven't received any supports in the past, or maybe they're newly eligible for Medicaid or an MSP, or there's questions about that, there's two places you want to apply. For the MSP, you're going to the state DHHS. For extra help, you're going to ssa.gov or local SSA branch. The other thing I should note about extra help and spend downs is when we talk about spend downs, if you do qualify for Medicaid and LIS through the first 6 months of the year, you are eligible for extra help the remainder of that calendar year. If you qualify for Medicaid in the last 6 months of the year, you're eligible for extra help for the remainder of the year, plus the full next calendar year. So just know that there are some varying timelines when you'll need to reapply. And again, Social Security slash Medicare in this case um, will help you through, will give your beneficiary reminders of that extra help and when their window is coming up. But a key thing we should point out here, though, is if your beneficiaries are taking extra help, that may slow down their spend down spending. And here's what I mean by that mouthful of words. So if they're getting extra help and maybe they're on an expensive drug that generally would cost 300 bucks a fill, 400 bucks a fill, something meaty, something worthwhile here, right? What that extra help does is reduces their out-of-pocket liability for that drug down to $11 and some change for that fill, which means where they were getting a lot of spend down that monthly deductible beforehand, now they're only getting $11 toward that $500 spend down, to that $400 spend down, which means they need to find other ways to to have medical spending before their actual Medicaid benefits kick in for them and help provide assistance there. So I just want to point out that that is a way the programs play together. It may not be logical. It may not make a lot of sense to us, right? The person does need help. That's why they're applying for it here. But your extra help in short can't interfere with any spend down you people may be subject to. All that said, we are talking generally about the first 5 categories here today. We'll be talking about FBDEs, QuimBs, QuimB Plus, Slim Bs, and Slim B Pluses here today as we talk about DSNP eligibility. Although QIs and QDWIs are eligible for some DSNPs too, and I'll show you what I mean a little bit later on here in this session. I've done a bit of talking here though. Want to check in with you before we go forward here. Make sure we are comfortable with eligibility. So Jane is one of your prospects, for lack of a better word. She is 36. She's worked for 10 years and been disabled for 24 months. So because she's been disabled for 24 months, she'll enroll in Medicare Parts A and B beginning next month. She currently receives both SSDI and Medicaid benefits. So knowing that she needs some support, she comes to your office and is interested in a DSNP plan. What steps might she need to take to become eligible, whether they are automatic or not?
So we need to look at what savings program she is eligible for. It should be an automatic process like you stated before, but unfortunately sometimes it isn't. So when she enrolls in Part A and Part B, we just need to make sure and check her eligibility.
Yeah, and I see different flavors of that coming in certainly in the chat. First, we need to make sure she does in fact enroll in Part A and B, right? So if we do provide, if your office does provide support with that, that's step one. But also make sure that she's put in that application, the 2 separate applications here, right? One to the Medicare Savings Program and another to LIS, just to make sure that she is in fact eligible for those programs. They go into effect. And of course, you can always double check that online, as many of you are saying, and as Kevin has said as well. So real quick, we'll talk about DSNP eligibility in a nutshell. Make sure we have, a few things under our belt before we talk about how DSNPs and Medicaid do work together. So again, as you were all right, they do have to be enrolled in Parts A and B. One thing we should point out is that when you're looking at a DSNP, eligibility is often limited, though not always, to folks who are 21 and up. Generally, if they're under 21, they may be eligible for other assistance or plans through the state here. Because MAPDs or DSNPs are technically MAPDs or Medicare Advantage plans, there's a lot of the same rules about service areas and things like that you'll pay attention to when investigating DSNPs here. We should note that you can enroll, or your beneficiaries can enroll in a DSNP year round. So as soon as they're eligible for Medicaid, they can go ahead and do it. They don't have and enroll in one of these. They don't have to wait for AEP or MAOEP to make that switch. And plans can and do limit enrollment to certain categories of Medicare savings programs. As we talk more about claims and how they work here, the big thing to take away is that Medicare or the MAPD, if you have someone that's on one here in the DSNP, that always pays first. They pay primary. Medicaid always pays secondary in this case. And if I look at someone who is fully dual eligible, say they go enrolled in a local DSNP, their PCPs on the DSNP agree to a contracted rate of $100 for a level 1 office visit. So something minimal. I've got the sniffles, something like that, doesn't need a lot of investigation. In this very vanilla routine case, your beneficiary has no out-of-pocket responsibility, but because behind the scenes, Medicare, or in this case, the MAPD, is paying 80% for that Part B service, Medicaid is going to be paying the remaining 20% behind that. So that 80 plus 20 is 100% coverage. Your beneficiary has no financial responsibility. But not every case is so cut and dry. And in fact, if you are at all familiar with PPOs, you know that PPOs do give you the option to go look out of network for care, and many DSNPs in our area are DSNP PPOs. So what does that mean? So say have that same beneficiary, she is enrolled in a DSNP PPO, but this time to treat one of her conditions, she goes and see an out-of-network specialist. In this case, the beneficiary still doesn't have any financial responsibility. But the way payment is happening in the background is shifted a little bit. The plan is going to pay whatever their out-of-network co-insurance rate is, typically somewhere between 50 and 70%. And if you have sold non-DSNP MAPDs, you're familiar with what those rates might be. But Medicaid is paying the balance of that, whether that's 50%, whether that's 30%, whether that's 40%. Medicaid is on the hook for the rest of that. So again, your beneficiary doesn't have any exposure here, but state Medicaid agencies are coming out of pocket for that. And we'll talk about some rulemaking that's happened lately to address that. The other thing we want to look at real quickly is an example for a partial dual. And I only take this one because this partial dual plan from UHC as an example because it has some of this language right up front here that really brings together everything we've talked about here today. So right here in the plan highlights from inside their Medicare product portal, you'll see that it calls out QuimB plus, SlimB plus, FBDE, QuimBs, QDWIs, QIs, and SlimBs, all as dual eligibles who may enroll in this plan. Meaning anyone qualifying for an MSP, whether or not they receive Medicaid, is eligible for this plan. So what does claims look like in this case? If you are a full dual and you enroll in this plan, you're subject to no cost sharing here. If you looked at the zeros here on the left side of that summary of benefits, that is what they pay. But your partial duals on these plans may have responsibility for a Part C premium, right? So full duals would pay $0 premium on this plan. Your partial duals would have a $35 premium on this particular DSNP. If you look down at other services on this DSNP, your full duals might have a $0 copay for outpatient or ambulatory surgery, while your partial duals might have a $225 copay. So when you're looking at DSNPs, especially ones built for partial duals, and you're like, hey, why isn't everything $0? It's because your partial duals are going to have some out-of-pocket liability here as well. Stacy has a question in the chat, and I do want to bring it up because it's a good thing to know for all of us to know is a DSNP PPO network different than a regular MAPD PPO network? And the answer, Stacy, you're not going to love, but it depends on carrier to carrier. Some doctors choose not to accept Medicaid, which means, and if they're not accepting Medicaid or any Medicaid, they'd be dropped out of the network here, right? They wouldn't be considered participating with the DSNP. So oftentimes you may see a little bit of variability between the PPO network in the regular MAPDs versus what you might see in the out-of-network case, or sorry, versus the DSNP case. So short answer is it's carrier specific. All that said, there are some weird things that can happen, especially with Medicaid redeterminations coming back into play here. When someone does lose Medicaid or loses eligibility for their or Medicare savings program, they do have a 6-month grace period to be redetermined. But during that time, their DSNP coverage is paused. What that means is during that 6-month grace period, the beneficiary is going to be responsible for all Medicare cost sharing they'd be responsible for under uh, original Medicare. So copays, coinsurance, deductibles, and premiums, their coverage is in effect paused while they have lost that eligibility. If after 6 months they are not redetermined as eligible, they'll be automatically disenrolled from the DSNP plan. But here is a good thing for us to know. There's 2 SEP opportunities here for your people, right? So if they lose Medicaid or they lose that MSP eligibility, that grants them an SEP. And they would also have an SEP if they did stick around for the full 6 months, did not get redetermined, and lost Medicaid coverage. That means that, because if during that grace period, they're fully responsible for any Medicare cost sharing under parts A and B and so on and so forth, it might be a good idea to take advantage of that SEP you get from losing Medicaid or losing MSP eligibility and find a $0 plan to put them in for a little bit. And then when they become re-eligible, if they become re-eligible for Medicaid, to go ahead and get them back on the DSNP at that point. Just a ways, you can look out for your beneficiaries and provide them. Let's visit Carla here for a moment. She's a beneficiary in a Quimby Plus, and she enrolls in a PPO DSNP. Her plan documents note that the plan covers out-of-network specialist visits at 70% coinsurance. How would you explain Carla's financial obligation for this specialist visit to either her or, more realistically, to her caregiver? What could that look like for you?
I believe since she is full Medicaid, she would have that out-of-network specialist covered in full.
You're exactly right. And so is everyone that's chiming in the chat here as well. Fun fact, though, in case this meets your definition of fun, in this year's CMS final rule, which Graham and I and Chelsea just dissected in a little bit deeper dive yesterday, CMS does limit the out-of-network cost sharing services for DSNPs. What that has the effect of doing is saving state Medicaid programs money. But carriers, on the other hand, I imagine aren't too thrilled about that because they're going to have to A, readjust some of their coinsurance rates, and B, eat some of that cost of the providing care for the DSNPs. Again, depends on your definition of fun, but that is a fun fact from the final rule. Some other bits and bobs that we'd like you to be aware of before we get out of here today are that because you're enrolled in a true MAPD, you're in a private plan here, every service can be subject to prior authorization as according to the carrier's coverage rules. But prior auths do have slightly different rules for your DSNP beneficiaries. So once something is approved, approval is valid for as long as the treatment is medically necessary. No additional approvals should be required. Emphasis on the should, because we all know that sometimes that appeals process, that prior auth process can be a bear to get through with some carriers. We should also note that for DSNP beneficiaries, because they have access to right now quarterly, but maybe soon to be monthly SEPs to change plans for DSNPs. If a beneficiary does switch to a new plan while they're being treated for a condition, the beneficiary has at least 90 days that they can continue treatment under that new plan before that new plan can require approval for the same service. So the prior auth is only carrier. If you do move to another carrier, that they have to honor that prior auth for 90 days, but on day 91, they can require approval for that same service or for that same drug, whatever the case might be. She'll also talk just a moment about coordination. Good question, Stacy. Not all services, but just services that would regularly be subject to prior auth under that. I misspoke earlier. Thanks for catching me on that. So your big ticket services that you usually think about for prior auth there in terms of surgeries or expensive drugs, those sorts of things. On coordination here, because there is some coordination that does happen behind the scenes, we should point out that Michigan is one of a lot of states that does not limit DSNP enrollment to plans that also have an affiliated Medicaid managed care organization. So what that means in plain language is that in Michigan, you can have one carrier administer your Medicare benefits via the DSNP/MAPD program, and a separate carrier administer your Medicaid benefits. So you may have Humana for your DSNP and McLaren for your Medicaid. And Michigan does not require you to be affiliated with the same carrier for both. However, in Michigan, DSNPs are required to follow all federal standards for the care coordination. The really key pieces to keep in mind when you're thinking about your beneficiaries is that the DSNP is in charge of notifying the state Medicaid of any hospital or SNF admissions, and the DSNP also facilitates any Medicaid coverage appeals. So say, for example, Medicaid, for whatever reason, denies a service or denies coverage in a hospital or in a SNF, even though the Medicare portion, the Medicaid plan approved it. The carrier has a legal obligation to facilitate appeals to the Medicaid organization. So long story short, if you do have a problem with coverage on a DSNP, the first best stop is the Medicare Advantage provider because they have an obligation to facilitate appeals elsewhere. One of your clients is taking a medication. She's a DSNP client, should point that out. Say she's taking a medication to address heart failure, and that heart does require prior authorization for that. She is interested, though, in using a SEP to enroll it with another DSNP carrier with a richer OTC benefit. What could you tell her about how that plan will treat her heart failure drug? What will happen in the first 90 days versus day 91 here in this case?
So I would tell her that the plan must cover her drug for 90 days before requiring new prior authorization.
Absolutely right. So while prior auths and things like that can always be a hurdle for people, they don't want to go through all of that over and over again. They do have some flexibility here, and specifically for DSNPs, because they tend to be these enrollees can be transient, right, from plan to plan. They do have that 90-day protection built in. For our anonymous attendee who asks, what happens when an individual has straight Medicaid, turns 65 and gets Medicare? Do they automatically change the appropriate MSP, or do they need to go apply for it? If they are already receiving Medicaid, generally speaking, they should automatically qualify for an MSP and receive letters from the state Medicaid agency about their qualifications and what they qualify for. However, as we've said, I think at least 10 times throughout today's presentation, that process isn't always as automatic as it should be because government, right? So it's never a bad idea to visit, in this case, DHHS, the Michigan Department of Health and Human Services, and file an application. The worst that happens is someone calls up and says, hey, why do you have two applications here? And we just wanted to make sure that, they got the benefits and support they were entitled to. So it never hurts to go and do that application. If you have someone that is on straight Medicaid, it should be on, but there's a lot of coulda, shoulda, woulda that sometimes happens with government programs. So thanks. I want to thank you all for spending your time and attention with us here this morning.